Welcome to the Healthwatch Luton AGM for the year 2020-2021. This is the second year that we've done the AGM by video for obvious reasons, and many organisations are doing just that. It's been tough for everybody in society, some more than others, but all have had their issues to deal with. Without being able to meet people face to face, it's been challenging to get feedback on services, but this has been achieved by Healthwatch Luton, again by remote contact, by videos, by telephone calls, etc., etc. Staff have adapted and worked very hard, while the volunteers have been somewhat frustrated not being able to get out and meet people, which is the main activity of the volunteers. Details of activities and findings are presented in this report later, and so you will get to find out exactly what has been achieved and what has happened. Hopefully we can now look forward to a better situation emerging and fulfilling our task to support the public and services providers as things get slowly back to normal. A big thank you to all staff and volunteers at Healthwatch Luton. It's been a challenging and difficult times, and adaptation to the situation has meant that objectives have been, in the main, achieved. I thank you all for taking the time and the opportunity to see our AGM, and I hope that we're able in the future to meet face to face and be more active in the work that we do. Once again, thank you, and I leave the rest of the AGM to continue.
Hi there, my name is Lucy Nicholson and I'm the Chief Executive of Healthwatch Luton. I just wanted to introduce this video which will outline some of the achievements that Healthwatch Luton have done over the last year. But firstly, I just wanted to say thank you to everybody who has contributed with their feedback. It's immensely important that we do gather your views on how you experience health and social care in Luton in order for your voice to help shape the care that you receive. Thank you very much. In Luton last year, Healthwatch spoke to over 33,000 residents. They reported and gave us feedback on over 200 services across the town, and Healthwatch Luton made over 50 recommendations on those services, of which half of our recommendations have been taken forward. So what did we do last year? Well, Healthwatch Luton spent a lot of time reimagining the way that we engage with people in Luton. Usually we can be found around the town speaking to many of you about your feedback, but last year, obviously with COVID, it was a slightly different approach. But it's really important that we get your views. Without your views and without your experiences, good or bad, we don't have anything to feed back to the system. And the system needs to put the patient at the heart of their delivery and their planning of care. So please, if you have any experience of health and social care services, do get in touch with Healthwatch Luton. Not only will we be able to provide you with information and advice, but we can hopefully use your voice to help shape the services that you receive. Thank you very much.
Hi, I'm Lisa and I'm the Project and Support Officer for Healthwatch Luton. Previously, we worked on two main projects for the mental health services in Luton and learning disability experiences of those who lived in Luton. We created a report for each of those, and to accompany each report was a RAR table. This is a recommendations, actions and review. The recommendations were shared far and wide across the system, and in particular the mental health report was shared and reviewed by the Overview and Scrutiny Board. The intelligence was shared with the CQC, with commissioners of services and organisations that provide mental health services in Luton. The report was also reviewed by the Adult Safeguarding Board, and NHS England Quality Surveillance Group used our recommendations and our feedback to look at ELFT. For mental health services, we made in excess of 45 recommendations. These recommendations were for the inpatient wards, but also for outpatients and also for the wider system for mental health services in Luton. Some of these recommendations have already been actioned, some are being worked on, and some are yet to be actioned. Of those that have been actioned, some outputs from those are on the mental health wards. There is actually admission packs that have been created with the Working Together group. Now, what these admission packs contain is information that is needed when a person is admitted to the ward. They're going to be reviewed in the next couple of months, and any changes of information or the way it's displayed will be considered. Also, ALF have monthly learning forums, and in these monthly learning forums, good practice is shared by those on different teams, different departments, different wards, and they come together to see what is working well for the patients and see whether or not this can be shared across the whole of the service. Luton Safeguarding Adult Board have commissioned some SARs, and these SARs are going to look at ELFT over the last 2 years and create a thematic report to see if there is any recommendations that can come from that to improve services for the members of the public in Luton. One of our recommendations was for a complex needs or a personality disorder service, or both, and this has been reviewed, and as part of the CMHT, which is the Community Mental Health Team Transformation, they are looking at ensuring that all staff have a trauma-informed approach and also can work with individuals who have a complex mental illness or do have a personality disorder. In terms of the learning disabilities, our report again was shared far and wide. It was shared with the local authority, and they also had a written statement of action. Now, this came off the back of an Ofsted that happened around 2 years ago, and some of our recommendations go hand in hand with the actions from the written statement of action. We have recommended that we work with the Parent Carer Forum to get some more feedback to understand what are the problems and what are the challenges that people are facing in Luton, and there is a new Parent Carer Forum that was created earlier on in this year. We have been working with carers, and we've gathered a lot of feedback over the last year from carers. We've held forums, we have made links with the local authority, and what we've been able to do is Healthwatch now sit on the steering group for the carer strategy for Luton, and also we've enabled some current carers to be able to be part of that also as part of the carers panel for the carer strategy within Luton. This means that their voice is being heard, this means that their experiences are being considered, and it means that the carer strategy will be a collaborative approach.
Hi, I am Sudha, the volunteer officer at Healthwatch Luton. We have a team of 10 volunteers, and this past year has not been easy for them, what with the uncertainty, the isolation, and the effect on their physical and mental health. However, they've continued to volunteer from their home and tried to adapt to the online systems as best as they could. They've represented us in meetings, they've conducted observational reviews of GP practice websites, pharmacies and dentists, etc., and also conducted telephone interviews and surveys to support us. Our volunteers have been involved in the local volunteering efforts by delivering food parcels and volunteering at the local vaccination center. Some of our volunteers wrote blogs for our website, reviewed our reports prior to being published, and they even reviewed healthcare policies and patient information leaflets for the clinical commissioning group. We couldn't meet face-to-face, so we arranged online meetings with telephone access for the non-digital volunteers. We've used these online meetings for weekly quizzes, social catch-ups, and for information updates. We also made weekly well-being telephone calls to make sure our volunteers were doing okay. To adapt our work to the pandemic, we created a new advisory subgroup to help support staff and the board. We are very fortunate that all of our volunteers have continued to volunteer with us. We even welcomed a new volunteer at the beginning of this year. If you or anyone you know is interested in volunteering with us, please do get in touch with me to find out more about how we can work together. I look forward to hearing from you.
My name is James. I have been a carer for a number of years now and have done a various amount of care courses through the Disability Resource Centre. I have tried helping my 2 daughters who have mental health issues, with one trying to take her own life in a hospital unit. This took a massive hit on my own health at the time. They now receive the appropriate care within their local authority. I currently care for my partner who has a learning disability and mobility issues, which can at times be very difficult. I managed to get our GP to do a referral for my partner for a learning assessment and to the council's learning disability team. With a bit of difficulty, my partner now receives 10 hours personal assistant support a week. This gives me time out for myself. The difficulty in finding activities within Luton is very hard, and doing an online search there is literally nothing to find. Everything seems to be in Bedfordshire. One of the PAs used to go to the singing cafe in Houghton Regis, so when she left I took over and now volunteer with them as a helper. The other group she attends normally is an arts group in Houghton Regis, which I found when doing a care course at the DRC with the trainer. She actually runs this group. Being a carer has been very challenging, but I would not give it up for the world.
Healthwatch Luton finances for the year 2020 to 2021. So we had a grant income of 119,000. There was a marginal overspend previous year of £2,000. So total income for the year was 117,000. Our expenditure for the year was primarily around staff costs. There's 86,000, slightly over on staff costs. Some costs obviously went down. We didn't have the travelling and expenses that we would normally have due to the coronavirus and not being able to meet face to face. We have, however, invested a little bit more in our IT solutions to be able to do the video conferencing work that we have been doing to maintain our activity throughout the year. We have an underspend of the year of 7,800, which will be put forward to the following year and be part of the recovery that we have to do in order to get back on track to provide services once the coronavirus issue is over and allow us to meet face to face. So that is the situation in respect of the finances for 2020-2021 for Healthwatch Luton. Thank you.
Hello everyone, my name is Isabella Spalding and I work as an Assistant Director of the Luton Community Mental Health Services and Bedfordshire Liaison and Diversion Service. The past year has been exceptionally difficult for our services, given the ongoing pandemic situation. The challenges relate to the staffing pressures, demand on our services, and the increase in terms of acuity of the service users' presentations. Despite the challenges, I found our relationship with the Healthwatch Luton has been stronger. Our working relationships have been much more positive, based on openness, transparency, and a mutual desire to improve the quality of the mental health services provision for our local population in Luton. Collectively, we have found the feedback and updates produced by the Healthwatch Luton as being much more balanced and contextual as in comparison to the previous years. And I believe that the quarterly meetings that we have with Healthwatch Luton, where my crisis colleagues and inpatient colleagues are also in attendance, have given us this opportunity to bring us closer together and give us plenty of opportunities to discuss concerns, any escalations, any progress towards so-called RA action plans that we mutually agreed on in terms of both inpatient and community mental health services developments and improvements that need to be put in place. I also appreciate the input from our Healthwatch colleagues in respect of our transformation work. The last year we have put plans and efforts in terms of developing our mental health services, and our Healthwatch Luton colleagues have been supporting us in that journey. We had great attendance in our public engagement meetings. We have ongoing attendance from our Healthwatch Luton colleagues in our regular work stream related meetings that really focus on particular areas of the transformation work. And the feedback and the support from Healthwatch Luton is invaluable for us and is really helping us to shape up our future mental health services. I'm really looking forward to be working with Healthwatch Luton in the years to come. And I'm very hopeful that we can develop our working relationships even further. Thank you.
Hi, my name is Sally Glancy. I work as a Carer Support Officer for Carer Central, which is part of the Disability Resource Centre. Carer Central have worked closely with Healthwatch Luton over the last year, and we refer some of our clients to Healthwatch if they have any issues that need to be addressed. Our clients have always given us good feedback, and their contact with Healthwatch has always been a positive experience. Carer Central look forward to working with Healthwatch in the future.